Good day. I'm Dr. Benjamin Van Ralt. I'm a board-certified plastic surgeon, and I have my practice, Iowa Plastic Surgery. I'm going to talk about different methods for body sculpting today. I'm going to talk about abdominoplasty, liposuction, and non-surgical methods such as the TruSculpt 3D. All of them, of course, are not weight reduction techniques. They are good for bulges, loose skin, or fatty deposits. If you really want to lose additional weight, that unfortunately has to be done by other means, not surgical or plastic surgical techniques. Even the best of them, such as a tummy tuck, we may only lose about 8 pounds total, and quite often less. Liposuction is safely limited to 5 liters, which again is probably no more than 5 to 8 pounds. And TruSculpt treats localized bulges or areas. Which to do depends on multiple factors. What area you're treating, how much loose skin there is, the quality of the skin, and your time in recovery. For example, an abdominoplasty may be needed for someone who has both loose skin and fat of the lower abdomen. Taking away fat alone could make the problem worse, with the skin looser and more relaxed. That is why an abdominoplasty sometimes after doing the examination is what we have to recommend. The abdominoplasty also allows us to tighten up the abdominal wall if it is stretched out after pregnancy. If a diastasis or separation of the muscles is there, that can be repaired at the same time. Contrary to what people think, the incision is not the painful portion. It's the tightening of the abdominal wall or fixing a hernia. The abdominoplasty, of course, has a longer recovery period, but it does lead to tightening of the extra skin. So if you have excess skin of the abdomen, you probably need an abdominoplasty. There are a few borderline cases where it's just a tiny amount of loose skin and more fat, and liposuction can be done as long as the person understands that they may look better in tight clothes, but naked they may be disappointed. In other words, there still could be some loose skin and not get the ideal improvement. None of the techniques will help deep body fat, visceral fat, or metabolic fat. If you have fat deep inside your abdomen, that can only be removed by things you do. Weight loss and exercise. And honestly, restricting calories is probably the best. If we have a combination of deep fat and exterior fat, an abdominoplasty still can be done, but you may not get a totally flat abdomen. There are several different types of abdominoplasty. There is a mini tummy tuck, which doesn't help the upper abdomen, only the lower abdomen. There is a variation that does do it differently with floating the belly button down if you have a very high belly button, but largely a mini abdominoplasty is for someone who has a pooch of fat or a roll of skin and the upper abdomen still looks good. A full abdominoplasty, the scar goes from hip to hip and improves both the upper abdomen and the lower abdomen, but does result in a scar around the belly button. There's also an extended abdominoplasty, where the incision goes around the flanks or hip area. It leads to a longer scar, but then also gets tighter skin on the sides. Over the last 30 years, that's the biggest change, where more patients are willing to accept a longer scar, but want to avoid that muffin top or extra skin on the sides. And lastly, there is what's called a belt lipectomy or body lift, where you go all the way around, usually after massive weight loss, but that is a much bigger procedure. Of course, any of the tummy tucks result in a scar, and the scar can pull too high, higher than you want it, because it's pulling in two directions. and therefore may be difficult to cover with a swimsuit, or you have to shop around for different swimsuits. We cannot promise that you can wear a bikini. I can only promise you'll look better in tight clothes, but how well it looks naked depends on how your body heals and what you started with. You also can have the scar be too high on just one side or another, because I'm doing the procedure with you laying down and asleep. It's not like a tailor where we can have you walk around the room and make adjustments. I'd like to, but my anesthesia says that's just not possible. So the scar could also be too visible or too red, although that's usually in my younger patients, and some people will need the scar revised later. It's imperative, absolutely essential, that you do not use any types of nicotine. Since we're cutting the skin, cutting underneath it, pulling it tight, the blood supply is severely impaired. Nicotine, unfortunately, cuts off an additional 80% of the skin circulation, and even 1 or 2 cigarettes can be the difference between a big patch of skin dying and you having a big hole in the abdomen and prolonged healing, or an uneventful recovery. Little areas of the skin dying, especially in the middle by the incision, are more common. Infections are a little more common after abdominoplasty since it's near the groin. I'd say they're closer to 2%. Little infections, because of reactions to the sutures, also occur. There's 3 layers of dissolvable sutures that can react. The lower abdomen will be numb, and that can be permanent. Other complications include bleeding, not that you bleed to death, but what's called a hematoma, and we have to re-explore, or a seroma, or fluid that we have to remove by aspirating with a needle. The recovery depends really if we have to tighten the abdominal wall. If we have to tighten the abdominal wall, the recovery is probably closer to 6 weeks. If we don't, for most people it's closer to 3 weeks. It's no heavy lifting, though, more than 20 pounds for about 6 weeks. There are a few people that their blood pressure or their pain tolerance is not what they thought, and they'd have to be admitted to the hospital after an abdominoplasty. Likewise, if you're not in excellent health, we may recommend that the abdominoplasty be done at the hospital. Abdominoplasties are not covered by insurance. The only thing rarely covered by insurance is what's called a pannulectomy, and there's pretty strict criteria and a lot of loose skin that have to be involved, and it only involves amputating that loose skin, not the rest of the abdomen. Now, if all you need is liposuction of the abdomen or the flanks or the thighs or arms or other area, that's a simpler procedure in terms of recovery. Most people, it's a week or 2, although you will feel more sore for a longer period of time. The results, though, depend on how well the skin shrinks. If you've got wonderful skin tone, you may get a fabulous result. If you've got so-so skin tone, you may go, well, it looks better in tight clothes, but naked, I'm kind of disappointed. We don't have an iron to iron you out or smooth you out. The best result would be in a 20-year-old who just has a fatty deposit on the hips or saddlebags. The worst result would be in somebody expecting to do their abdomen who's had 4 or 5 children and a lot of stretching. None of them will improve stretch marks. A tummy tuck will remove stretch marks in the area of the skin that we remove. If you have additional questions on these, go look at my website, and we do have before and after pictures. The limits on liposuction, as I said, are no more than 5 liters at a time to be done safely, which is, as I said, 5 to 8 pounds. Now, there's also non-surgical methods. There's Kybella, which is an injection. There's cool sculpting, which is had the most advertising. And we have the TruSculpt 3D. We picked the TruSculpt 3D because we think it has the best results. It has, all of them average about 25% of the fat layer. That means you might have to repeat it. Again, it's not a massive change. It takes 3 months for the damaged fat cells by heat to dissipate, so you won't see it overnight. And to be honest, all the non-surgical methods, 15 to 20% of patients will be disappointed. I tell them to think of it like a vacation. Sometimes we go on vacation before before 2020 and COVID hit, and the weather doesn't cooperate or the airlines don't get us there, and 1 out of 5 vacations is kind of a bust. And that's kind of how you have to think of doing a non-surgical fat reduction method. The remaining 4 out of 5 will see an improvement. And with the TruSculpt 3D, there's little or no downtime. I did it myself, and I felt just sore the next day when I touched it. But if I didn't touch it, it felt fine. It is a little uncomfortable, and if you have an extremely low pain tolerance, it might be difficult. You can repeat it. It's priced per treatment area, and a treatment area is about the size of your hand. So obviously the love handles would be 2 areas that you would do. You can do up to 4 areas at one time, and you can repeat it quite soon afterwards. The reason we like it better than the other methods, the Kybella is more costly, takes multiple times of injecting, and a lot of bruising and swelling. The cool sculpting can only treat what it can grab. It's a freezing method, and long-term changes with frostbite sometimes are a problem. In addition, there are some people who get paradoxical increased fat, and they can get step-offs. So we think the TruSculpt 3D is both a faster recovery and better results. The amount of fat removed varies from 10 to 35%. So those are our methods of improving body sculpting, either non-surgical or surgical. Liposuction can be done anywhere, really. The most common areas are thighs, abdomen, love handles, underneath the chin, bra rolls, and arms. Lesser areas, well, we combine it with surgery for the male chest. Lower legs are very uncommonly done. There's a lot of swelling and a lot of prolonged recovery, as well as quite often what patients think is fat is just an abnormal muscle distribution. But yes, we have pictures on our website if you'd like to see them. And we're glad to take your questions about any of these procedures. Thank you.